$2 trillion. That is the amount of money that Trump has signed into existence as part of the Economic Rescue Bill to help lift the economy and address the coronavirus pandemic. That is an unfathomable amount of money. To give you some idea of how much money this is, here's the size of a $1,200 stimulus check that 70 million Americans recently received. This is the median income of an American at $33,000. Here's the stimulus check that 43,000 of the wealthiest Americans received, equating to around $1.7 million. Here is Jeff Bezos' net worth at around $145 billion. And here is what $2 trillion looks like. And I'm not kidding when I say this is a lot of money. Hello and welcome to The Quarantined Life. In 10 simple steps, I'm going to show you how the Trump administration right now is scamming Americans of potentially trillions of dollars for both financial and personal gain. And yeah, it might sound clickbaity, but seriously, wait till step 6 to see how corrupt this whole situation is. Step 1. Eliminate oversight. Trump has recently signed a $2 trillion coronavirus relief bill, which includes $500 billion in assistance to large companies on two conditions. Firstly, the Inspector General is not allowed to consult with Congress, and secondly, spending decisions would not be dependent on prior consultation with or the approval of congressional committees. So basically now there is $2 trillion available with no congressional oversight, and even the Inspector General watching over the money is not allowed to consult with Congress. Step 2. Remove the top watchdog and replace with an ally overseeing the distribution of the $2 trillion. Glenn Fine was initially selected by the head of a council of Inspector Generals. He was then removed by Trump and replaced by one of his allies, Sean O'Donnell, the Inspector General at the Environmental Protection Agency. So now, just after 2 steps, Trump is able to spend the $2 trillion however he pleases with no oversight. Step 3. Enact the Defense Production Act to eliminate competition. Under the Defense Production Act, an American company must sell its products to the US government upon request. Basically, this allows the government to direct private companies to produce goods for them at any time. Through the Defense Production Act, the government called on a number of companies to manufacture the emergency supplies, including companies such as 3M, General Motors, and Ford. To put it simply, by enacting the Defense Production Act, you can create a monopoly on the production of the bulk of the medical supplies. Step 4. Attack any company that does not play by your rules. What Trump does next is attack any of the major manufacturers of the coronavirus supplies that don't play by his rules. An example of this is when Trump publicly attacked 3M and started a public dispute. Trump said in a tweet, "We hit 3M hard today after seeing what they were doing with their masks. P-Act, all the way. Big surprise to many in government as to what they were doing. We'll have a big price to pay." Eventually, 3M and the White House came to a, quote, very amicable agreement that would supply 166 million respirators to the US over the next 3 months. So now these large manufacturers are publicly vilified to continue to feed cheap medical supplies to the government. Step 5. Create further demand for supplies due to scarcity. The Strategic National Stockpile was created in 1999 and stocks a number of important medical supplies such as N95 respirators, gowns, and shields to protect Americans from pandemics. On the 2nd of April, Jared Kushner stated in a White House coronavirus press briefing,
"The notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use."
The reason he said this is to 1. Limit the availability of supplies directly from the government to the states, and 2. To force states to have to use private distributors for medical supplies. It's also interesting to note that although Trump has claimed that Obama left him an empty national stockpile, that's not really the whole story. However, even if it was, the Trump administration has had 3 years to fill it back up. So now you have $2 trillion available, with no oversight, large companies producing massive amounts of medical supplies for cheap, and states have limited access to federal supplies. So what do you do next? Step 6. Get trusted allies to create private companies to which you can funnel money into. Now this is where it gets really interesting. There is a 3-week-old company called Blue Flame Medical LLC founded by Mike Gula, through a loan approved by the coronavirus stimulus bill. In fact, Blue Flame Medical was founded on Monday the 23rd of March, and just 4 days later, they were promoting themselves as the largest global network of COVID-19 medical suppliers, providing healthcare logistics and hard-to-find medical supplies to beat the outbreak. Mike Gula has previously fundraised for a number of Republican senators. In addition to this, Mike Gula started Blue Flame with John Thomas, who until recently worked as chief strategist for a Republican called Don Sedgwick. In a recent interview, John Thomas said, "I don't want to overstate, but we probably represent the largest global supply chain for COVID-19 supplies right now." When Thomas and Gula were asked how they managed to obtain the masks that have become so rare that some hospitals have resorted to reusing them, or using other cloth alternatives, he said, "It's just relationship based, and I can't say anything else." Now what I'm wondering is how does a company suddenly become the largest supplier of COVID-19 supplies in the world in just 4 days? Step 7. Sell stockpiles to your allies for cheap. At this step, you have the federal government sell its stockpiles at reduced prices to the new companies run by your friends and allies. Just have a listen to this exchange between CBS News reporter Wei Jiang and Admiral Pulauzik.
This product that we're moving is primarily commercial product that would enter the commercial system and be distributed through financial business transactions between hospitals and these distributors.
So just to clarify, that explains why states say they're bidding like they're on eBay, because the supplies are going to the private sector, and then they have to go there to get the supplies.
That's normally how things work, right? So I'm not here to disrupt a supply chain.
Expressed by Weijia Jiang, why are supplies going to private companies to sell to states, rather than being directly sold by the government to the states? To give you a better understanding of the why, there is also a private company involved in the distribution of medical supplies called Panthera Worldwide LLC. It's interesting to note that Panthera Worldwide hasn't had any employees since May 2018, and it also has no history of manufacturing or procuring medical equipment. And it was awarded a contract by FEMA for $55 million worth of N95 masks. And what's crazy is that this contract with FEMA was awarded without competitive bidding. And what's even worse is that the price that FEMA is paying Panthera Worldwide per mask is about $5.50, compared to just the 63 cents that the government buys them for from companies like M3. So by using the Defense Production Act, you can create an abundance of cheap medical supplies. Then the government sells them to private supply and distribution companies who then sell them for inflated prices to the states. Step 8. Use taxpayers' money to ship supplies to further reduce costs for private companies. To further reduce costs for the private distributors, the federal government spent taxpayers' money to ship supplies purchased from China to these brand new companies. There were more than 20 flights through early April for the public-private partnership called Project Airbridge. This was all occurring while Trump continued to urge states to buy their own medical supplies, which were in short supply across the country.
But we are backing you in terms of equipment and getting what you need. Also, though, respirators, ventilators, all of the equipment, try getting it yourselves. We will be backing you, but try getting it yourself. Point of sale, much better, much more direct if you can get it yourself.
Step 9. Cause a bidding war between states.
New York's Governor Andrew Cuomo expressing frustration at the lack of federal coordination as states seek supplies to fight the pandemic.
It's like being on eBay with 50 other states bidding on a ventilator. And you see the bid go up because California bid, Illinois bid, Florida bid, New York bids, California rebids. That's literally what we're doing. I mean, how inefficient.
As NBC News succinctly writes, the brutal competition for everything from ventilators to masks to other forms of personal protective equipment comes at a time when scarcity provides lucrative business opportunities in the private sector and power to the deep-pocketed federal government. So rather than buying directly from the government, the governors were forced to buy medical supplies for inflated prices from private companies such as Blue Flame Medical and Panthera Worldwide. However, not only were the supplies outsourced to the private sector, the bidding was also outsourced to private companies. This eBay-style bidding was done through private service companies like the broker Every Ancillary, who played the middleman between sellers and bidders of crucial medical supplies. Step 10. Continue to rapidly distribute the funds to your allies without any oversight. On the 6th of April, Bharat Ramamurthy became the first person named to the Congressional Oversight Commission, who was supposed to police the massive $2 trillion coronavirus relief bill. And after more than 9 days, he still remains the sole person appointed to a panel, which is supposed to have 5 members by the new law. In fact, apart from not having any other people on the panel, Ramamurthy has no colleagues, no staff, and no office, relying on his unverified Twitter to communicate with the public. In fact, just as writing this video, Bharat Ramamurthy has written an article for the New York Times, which is titled, "I'm overseeing the coronavirus relief bill. The strings aren't attached." And the really bad thing is, he's still waiting. Thanks for watching all. If you like this type of content and want to help support the channel, please smash that like and subscribe button with your elbow. Also feel free to check out my other video series where I delve deep into the question of how the United States became the epicenter of the coronavirus. And as we always say here, don't forget to wash your hands.